Hello from Sunshine Coast University Private Hospital. This video has been created for parents, carers and guardians of paediatric patients to help you and them better understand what to expect on their surgical journey from admission to discharge.
In the days leading up to surgery, you will be contacted by the surgeon's rooms. You will be given an admission time, a fasting time and a clear fluids time. Please don't let your child fast longer than they need to. If possible, give them something to eat right before their fasting time begins and give them clear fluids until the time you have been given. This helps prevent nausea, headache and irritability before and after surgery. We understand that coming to hospital may be challenging and confronting. Keeping your child informed can help alleviate anxiety for both of you.
On the day of your surgery, enter Sunshine Coast University Private Hospital through the main doors and take the lift to level 1, where you'll see day of surgery admissions directly opposite.
Check in with one of our administration staff, then please take a seat until you are called to the desk. You'll be asked to confirm personal information and present their Medicare card. You'll also be asked to make any payments required at this time, including any private health insurance excess or co-payment. You can both take a seat until a nurse comes to take you through to our admission room. We have multiple theatres operating simultaneously, meaning our admission space is busy. So we ask that only one adult carer accompanies each paediatric patient and that you do not bring other siblings with you. You and your child can stay together all the way to theatre and you can be present until your child goes to sleep. In the admission room, one of the nurses will take your child's height and weight and some baseline observations. We will also review their health history and do our best to answer any questions you or your child may have. Please remember to bring in any regular medications your child takes in their original packaging. The admissions nurse will go through these with you and pass them on to the anaesthetist to document. In the admissions room, your child will be invited to change into a hospital gown. But if that doesn't feel right for them, they can usually go to theatre in their own comfortable clothing. They're also welcome to take along a simple comfort toy or blankie.
Next, you'll be welcomed to the pre-op waiting area, which may require patience. We know that no one likes waiting, especially when you may feel a little anxious before surgery. Estimated surgery times are only estimates, and sometimes surgeries take longer than expected or there may be an unforeseeable delay. Please be patient and trust that we are always doing our best to get you to theatre in a safe, timely manner. Nursing staff will try to keep you updated if there are delays. Remember that because we have multiple theatres with different lists, patients won't necessarily move through in the order they arrive. If you have any concerns, don't hesitate to speak to our nurses who are here to help.
Children often find the waiting time challenging, so feel free to bring along some quiet activities that might keep you both entertained, like books, colouring in, cards and devices. Your child's surgeon and anaesthetist may see you during this time, and it's a good opportunity to touch base and ask any last-minute questions. Each surgeon has a different practice, so don't be concerned if you don't see your team here. They will catch up with you right before you go into theatre. We appreciate that waiting for a child who's in surgery is difficult. You are welcome to make yourself comfortable in our waiting room on level 1 or the hospital lobby where the cafe is open until mid-afternoon, Monday to Saturday. It's a good idea to grab something to eat during this time so you are well-fueled and energised to support your young person. Please stay close to the hospital, as a team member will call you and bring you through to recovery as soon as possible. When you come to recovery, don't be alarmed if you find your child crying or upset, as it's a common effect of some anaesthetic medications. Our experienced recovery staff will have pain relief and anti-nausea medication on hand should it be required. Paediatric patients usually stay with us for 2 hours once they are awake, although those that have had a tonsillectomy will stay for at least 4 hours. Most of this time is spent in an armchair in our discharge lounge. This space is shared by adult and paediatric patients. Don't be too eager to offer your child activities at this time. Encourage them to rest, as generally the longer the rest, the better. Expect your young person to be pretty miserable at this time. They may complain of a sore throat and crave water. They will be offered an ice block as soon as they can tolerate one. The cold goes a long way to relieve a sore throat and allows them to have a small, controlled amount of fluid, which is more gentle on a potentially fragile stomach than a glass of water. If they tolerate an ice block, we can then offer more substantial food and drink. We have many food options and can accommodate most diets. However, if your child is particularly choosy, you may wish to bring in some of your own food. It is not uncommon for children to vomit after surgery, even despite being given anti-nausea medication during their procedure. While this is usually unpleasant and may be distressing, it is rarely a concern and often makes the child feel better. If necessary, nursing staff will give anti-nausea medication and review food intake to try to avoid further vomiting. Keep in mind that pain or vomiting may extend the patient's time in recovery. It is important your child is tolerating fluids and has passed urine before being discharged. Your surgeon will usually come and check that both patient and carer are doing well before discharge. They do this between procedures, so there may be a wait. Your young person will need your undivided attention. If your child has more than one carer at the hospital, you are welcome to swap carers at any time during the child's recovery. We want every child's surgical journey to be as pleasant as possible. If you have any questions before or during your child's day of surgery, please speak to one of our team members, as we're here to help.
From all of us at Sunshine Coast University Private Hospital, we trust your experience is a positive one and we wish you all the best with your surgery and recovery.